Welcome to the Taiwan Outlook. I'm your host, Raymond Wu. In this segment, we will continue our discussion with Dr. Andrew Huang, the President and CEO of the Koo Foundation Yat-Sen Cancer Center. Dr. Huang, in this segment, I want to start off by talking about Taiwan's universal health insurance system. People often say this is a model for other countries to emulate, but actually we have a lot of problems in this system still, especially you've been back in Taiwan now 19 years. You've been a first-line witness to the growth and the development and the problems that come with it, in the system. And you also had, another 20, 25 years of experience and ongoing still in the U.S. How do you think this, so-called health insurance utopia in Taiwan, is that a myth? Was that a reality for others to follow?
Well, I should answer this by making providing a few database.
Yes.
Currently, we spend about 3.8% per capita GDP by the National Health Insurance.
Okay.
And so that actually, I think, is not enough. I think U.S. spending 15% is too much.
Okay.
I would say while the National Health Insurance spends 3.8%, there's also out-of-pocket
expenses
spending
by the patients
for health.
Yeah.
Right. So globally speaking, if the national health expenditure is 100%, out-of-pocket payment constitutes about 37%.
Okay, so a little over a third, yes.
And that's a lot,
okay.
Actually.
Yes.
The National Health Insurance covers only 53%. And there's that 10% coming from the government for public health
subsidies,
activities.
Yes.
So the total expenditure for health now is about 5.3%.
Okay, all right.
And I think we should spend probably, and the current government says so, that we probably need to spend about 7.5% instead of 5.3%.
Okay.
The result of this low expenditure actually has caused the education to be de-emphasized.
Okay.
It has also caused the healthcare providers to increase their volume.
Okay.
Because they don't feel that they are getting proper
compensation. Yes.
And so the care is rushed. Most medical schools are underfunded.
Okay.
Residencies depend on the hospital's income, rather than being paid to some extent by the insurance or the government.
Yes.
So I think using these figures, one could actually see pretty well that while we have near 100% accessibility, we have very low reimbursement. And so the reason why healthcare providers spend so little time per patient is because they want to increase their volume.
Okay, yes.
In order to bring in sufficient amount of money to
revenues,
to sustain.
Yes.
And if we continue to do this, the National Health Insurance I would view as unsustainable.
Yes.
And the lack of emphasis on education and training of health workforce will result in low quality of care. Even though the previous CEO of the Bureau of National Health Insurance had started payment for performance in limited number of diseases, like in 5 different diseases.
Yes.
it really has to be expanded more.
Okay.
One thing that I would emphasize here is that healthcare providers are paid money
yes.
for the procedures they perform, for the drugs they prescribe,
yes.
rather than being paid for the results they bring.
Okay.
So I think we need to change our concept from current situation to outcome-based payment.
Okay. Well, quality-based
yes. payment.
Okay.
So in summary, I would say accessibility is only the first step
exactly.
toward universal coverage. What needs to follow very closely
yes.
To the accessibility question is the emphasis on quality of care,
yes.
the emphasis on public health as a more effective way to prevent the occurrence of diseases, and to emphasize education of healthcare workforce.
Yes.
So I would encourage the current government to increase the investment in healthcare without increasing the out-of-pocket payment,
okay.
but to increase the national health insurance portion of the national health expenditure.
Okay. All right.
And I certainly would want the government to listen to our pleas.
Okay.
I am working currently with the Academia Sinica.
Good.
And so in early November we'll have a meeting, and I will hand in my proposal and recommendation to them. Now, through the Academy, I hope that the government will listen and will begin to make changes or healthcare reform toward that direction.
Yeah, I think Taiwan's healthcare insurance has received a lot of worldwide attention. It's because what you just mentioned of the accessibility concept. Used to, of course, in Taiwan, that people have varying degree of insurance coverage, and whether it's labor insurance or government insurance or private insurance. But do you see that, although we still have a lot of problems with our insurance system, but do you see other countries, especially in the developing world, neighboring countries around us, that are thinking of looking after and examining the model in Taiwan, to be implemented in their home countries?
I would say that while they are aware of the program in Taiwan, I am not so sure that they're going after this program without much consideration of the potential cost to their country.
Yes.
Taiwan is able to do this by cutting the cost.
Okay.
But a lot of countries would not follow Taiwan's model. Taiwan's model, I think, is I would say there's it's very. I don't want to discourage by saying that Taiwan hasn't done a pretty good job. I think the universal coverage is done now, but the quality of care is poor.
Yes.
Education is ignored. There's not enough money spent on prevention, on education. For example, chronic illnesses now occupy 50 to 60% of our illnesses.
Really?
And many of these chronic illnesses can be reversed. For example, so-called metabolic syndrome, obesity, hypertension, diabetes, and cardiac problems, renal problems.
Yes.
They are the results of this modernization. And I think that is reversible.
Yes.
And diabetes can be brought under better control if we control our diet. We actually suggest their exercise program so that they're not overweight.
Yes.
And blood pressure will come down.
Yes.
Diabetes or glucose intolerance would also come down. And I think we should work on those areas instead of just spending money to treat diabetes.
Yes.
In Taiwan has the highest number of renal dialysis in the world.
Yes. Yeah.
And and this is really, to me, is an embarrassment.
Yes.
Taiwan still has a pretty serious situation with tuberculosis.
Okay.
Roughly about 16,000 people per year will be affected by tuberculosis.
Okay. Yes.
And the mortality rate from tuberculosis is the highest in the world. Because most of the patients are not getting
the kind of
treatment that they need to be treated. Currently, I think the government is aware of this and is making some headways. And I hope that this would be eventually successful. As I mentioned, that chronic illnesses occupy 50 to 60% of all the illnesses.
Yes.
Taiwan needs to pay attention to the environment.
Of course.
The environment and environmentally associated illnesses occupy roughly about 10 to 20%. And I think we need to
quite high. Yes.
we need to invest in that to provide a healthier environment for our citizens. Genetic illnesses is the other 10%, and I think we're kind of behind on this. But of course, you know, our healthcare is not as sophisticated as in the advanced countries like U.S. But I think we eventually will catch up.
Yeah.
But I feel that we are doing too little in the way of prevention.
Okay.
We're doing too much in prescribing drugs.
Yes.
And the drug cost in Taiwan now occupies about 25% to 30% of the total national health expenditure.
Yes.
Which is way too high.
Yes. So in our discussion with Dr. Huang, you know, one thing we learned is education, that we need to put more emphasis on that. And second thing we need, you know, to pay more attention is the quality of healthcare that the health professional provides. And that will be the topic of our discussion when we come back after this short break on Taiwan Outlook.